have a confession to make. And I have to be honest, I don't know how this episode is going to land for you. I struggled with whether I should put it out, whether I shouldn't put it out. And I don't often have to think about that, but I did with today's episode. And what I have decided is that I'm going to put the episode out and ask you to stick around to the end because there we went over time, first of all. So there was one thing at the end of the conversation that I didn't push back on as much as I ho- really wanted to, especially after we got off of the call. So I want to address that at the end of the episode. And I think it also brings up two other topics that are very important that we need to have conversations about. So today's episode is going to be a little bit longer, not only because the recording went a little long, but also because I hope you stick with me at the end of the episode so that I can kind of explain my thought process a little bit and some of the things that I hope you take away from the episode and for your pets and in decision making for your pets moving forward. So I'm not going to spend too much more time here at the beginning. I really want you to stick around to the end so we can talk about this. Welcome back, pet parent. My guest today is Dr. Kevin Toman, and he is joining us from beautiful, sunny Southern California. I'm so jealous right now. Dr. Toman is, well, I'm going to let you talk and speak to everybody about this, but he talks a lot about longevity in our pets. So we're going to go down that road. I've got some questions, but first, before we jump into any of that, Dr. Toman, welcome. And can you tell us a little bit about yourself and how you got into the practice of veterinary medicine?
Sure, Jess. First off, thank you very much, Jess, for your time and your knowledge. I'm just tiptoeing into this podcasting world, and I'm learning how much work goes into podcasting behind the scenes.
So much.
And so your listeners may not realize all the work and the time you put in. So, but on their behalf, thank you. I mean, the reality is all of us pet parents are we're in the same boat together, and you're doing an awful lot to help pet parents and their pets. So thank you again for everything that you do.
Well, thank
And so
you.
with that being said, yeah, my name is Dr. Kevin Toman. I run a business called www.helpingpetslivelonger.com because that's what my team and I do 7 days a week. And so I use a combination of telemedicine consults, supplements, and prescription longevity drugs like rapamycin and acarbose to help pets live up to 25 to 30% longer.
Yeah, that's a big conversation today, and I kind of want to just dive into it if you don't mind. Eh, my Most of the information that I have garnered in the longevity space is in the human space.
Hmm.
And one of the things that I kind of struggle with a little bit is, you know, hyper focusing on like one thing, hyper focusing on cold plunges or hyper focusing on sauna or hyper focusing on whatever it may be.
Hmm.
We can we could go down the path of are GLP-1s good or bad? I mean, they're peptides and peptides are naturally occurring. And can we do this better by fasting? Blah. We could do all of the things and talk all about those things. My bigger concern and what I'm hoping that we can kind of converse a little bit about is how longevity and health span play a role together and how we can get both longevity and longer health span in our pets because we don't whether it's with our pets or whether it's with humans, we don't just want longevity for the sake of longevity. We actually want quality years. So how does that work with what you do?
Well, gosh, you've rolled about 5 or 6 questions into one, and,
Right?
so so let's start by saying, yes, I agree 100% with your thought of health span as opposed to lifespan, and unfortunately, I can use my late mother as a prime example of that. My
Okay.
mother was a smoker throughout the vast majority of her life, And eventually it caught up with her, as many times happens, and she developed lung cancer. And the last 2 years of her life were spent in bed, confined to a hospital bed, because of lung cancer that had spread to her hip bone.
Wow.
And so, although she lived that extra 2 years, the reality is that I would challenge that you when we speak of inequality of life there. And so, my clear goal is to extend not so much lifespan, but much more health span. Our goal is to maintain quality of life for your pets for just as long as possible, and that is sometimes different than true lifespan.
Yeah. I think well, and I think the reason I brought it up is because that is an important differentiation. But we do want our pets to live a really long time. We want them to live longer than they're living, and the
Yeah.
reality is that their life sorry about that. That's my dog. Um, for both dogs and cats, their lifespan in the past, let's just say 40 years to be conservative, has decreased significantly. And there are a lot of factors to that. Like it'd be nice to be able to point to one thing and say, this is what we need to change. But I think there's multiple things we need to change. And so how do you see that? Because I mean, the numbers
Yeah.
are what they are.
Well, yeah, and so I'd love to have a look at those studies because I think in general, both dog and cat lifespans are up across the board. So I would be curious about that. But yeah, and we could talk about why that might be. But I would say that, one of I guess I didn't answer part B to your question, so I'm gonna back up by one question, and we'll circle back around. Because, one of the things, Jess, that people do mistakenly is, well, perhaps not mistakenly, but from simplistically, let's just say that, is they contact me and say, "Hey, Doctor Kevin, I'd like to get my pet started on rapamycin or one of these prescription longevity drugs because I want them to live longer." And while that might be true, I would tell you, Jess, that far and away the best longevity results, whether we talk about lifespan or more importantly health span, are going to be received by looking at health span or longevity as really kind of a four-legged chair. And so let's don't skip just straight to prescription longevity drugs, which, by the way, are the single most expensive way to get there. And listen, just like your GLP ones, they are undoubtedly effective. I mean, I can speak a lot more directly to prescription longevity drugs. But the other three legs to that longevity chair are simple: diet and lifestyle, and then traditional veterinary care, in particular dentals and diagnostics. Then we have some supplements that I'd love to discuss with you. But in the absence of those diet or lifestyle changes, in the absence of at least some veterinary care that is logic based, and because that is not always the case. But the reality is that nobody is going to be able to live as long, whether you choose to use prescription longevity drugs or not. You have to look at diet. You have to look at lifestyle, what your pets should do in the form of exercise, what they shouldn't, how your house is laid out. As funny as that sounds, from a pet longevity perspective. And these are all things that any longevity assessment should include. And so, with that being said, I do believe that pets in general are living longer, but the hard part is that exposes them to a host of geriatric diseases. Cancer incidence is up primarily because we're not seeing a lot of dogs getting hit by a car. Cat heart disease is up because we're not losing as many cats to leukemia as we did before. And so, as somebody who specializes in longevity science for our pets, now this old age opens up a dramatic new list of problems that you and I need to deal with, and in many ways, a bigger challenge that is best met by a lot of different approaches, integrative medicine as it's truly defined.
Well, and I think that is what we have to be able to wrap our heads around today
Absolutely,
is
you're
integrative
entirely right.
medicine.
Yeah,
Because and, the reality is, me and on this podcast, I am very, like, diet and environment focused, and I think we can do a lot just by and like you just said, we can use these longevity drugs, but we have to address these other things as
you're
well.
a you are 100% correct, Jess.
And, I look at first and foremost the fact that we're not treating our animals as the species they are. And that can be really difficult for some people to wrap their heads around too, right? Like a cat is a totally different species from a dog that is a totally different species from us as humans. And to actually, like, we don't treat them that way. That's just not how pet ownership has evolved. We don't treat our cats as obligate carnivores,
Hmm.
generally speaking. And if we did treat our cats as obligate carnivores, their lives would look very differently. And so there is always that debate about indoor time, outdoor time, and you talked about being hit by cars and all of that. And obviously, we don't want any of that. Um, bringing as much nature back into the environment as we possibly can, whether
Hmm.
that is through actually getting outside and getting that morning sunlight and setting our and our pets' circadian rhythms for the day versus using red light therapy,
Yeah.
making sure we have clean air and clean water, which actually isn't that easy to do these days. But these are kind of fundamental staples. And then we can, as you said, look at this integrative approach because the reality, for me at least, is that the way veterinarians are trained traditionally in today, like what we call traditional veterinary medicine, is so valuable, exactly like you just said, for diagnostics. If my dog doesn't get hit by a car, I absolutely want to rush them to the vet
Yeah.
and get them pain medication and have it set, or hopefully not have to have it amputated, but who knows? Like, these are things that we absolutely do have to include, and the longevity drugs are fascinating to me and terrifying to me, which is why I'm kind of excited for you to tell me not just about these longevity drugs, but also about all, the supplements that you do like to recommend.
Yeah,
Because
absolutely.
we live in a world where it would be ideal if we didn't have to supplement, if we could get everything we needed from our food, or if our pets could get everything they needed from their food, but our soil is dead. And by the time, these ingredients are getting, whether to our kitchen counter or to the manufacturer to go into the food, what kind of nutrient value do they have left anymore? So supplementation that's a hot topic for me.
Okay. All right. Well, yeah. So let's talk about any hot button topics you have. And so let me just make a few observations and see what
Yes.
resonates with you. But I would tell you that from a dietary perspective, and listen, I'm looking at my golden retriever puppy Annabelle as I talk here. But for 50 of the 66 years I've been around, Jess, I would have said, "Oh yeah, just feed your dog kibbles," and that's really the healthiest approach? Well, it's certainly the cheapest approach and it's certainly the most convenient approach. But the reality is, over the last 20 years or so, there's just been study after study that tells us kibbles are actually not a healthy approach to feeding our pets, whether you happen to be a dog or happen to be a cat. As you suggest, I have seen people try to make vegetarians out of their cats and end up with dead cats. I have seen that happen with my own two eyes. We could talk about raw diets and listen, I home cook for Annabelle because I believe that way I can control exactly what she eats. I know exactly what she's putting into her mouth and why. And for instance, one of the things that she gets in every meal is broccoli. I use a rotational diet, Jess, but golden retrievers are so prone to cancer. And broccoli has one particular ingredient called sulforaphanes that are proven cancer fighters. And so part of little Annabelle's meals on every day is broccoli. And we could talk more about the logic around cancer therapy and early cancer diagnostics. But where I really want to go is what you alluded to last, and that is the role of veterinary medicine in keeping your pets healthy. Because I would tell you again, and let me be clear, I graduated from vet school before you were born, back in the dark ages of 1986. And I would tell you that
I was
my opinion,
born.
well, you don't look like you were born.
Thank
And
you.
so I would tell you that my opinion, as somebody who's been in the veterinary field for 4 decades, is that veterinary medicine, as it's practiced right now in small animal clinics in the United States, is broken. And I can approach that from a relational perspective. I can approach that from a financial perspective. But I would tell you that we veterinarians are not doing as good a job as we should for the pet patients in our care. And there are a number of different explanations for that, which we can talk about. But I agree with your statement. So I just wanted to give you a few talking points and whatever I can chat. ad nauseum about supplements for you. And so, whatever you feel your listeners, your pet parents would find most interesting, I'm happy to wander on down that path with you.
Yeah, I think supplements would be interesting, but before we get there, I would love to hear what you think about what is broken in veterinary medicine today, because I'm right there with
Okay.
you, and I have a number of theories myself, but never having been a veterinarian, or even worked in a vet clinic. Just
Yeah.
be fair. I'm just making assumptions or educated
But
guesses based.
I think that many times those assumptions are legit because you're basing them on your learned experiences. And so what I would tell you is that when I graduated from veterinary school, and I think this is true to this day, I had 0 training in psychology or building relationships. You know, I thought I was pretty smart when I first got out of school. That lasted all of about 3 days until I realized that I was truly book smart, but experience dumb. And, veterinarians through the years, we are very good as a trade at solving problems. If you bring us a problem, whether it be that fracture that you just spoke about, or a cut foot, or a cat with an abscess, veterinarians are generally pretty darn good at solving those problems. But what we're not good is sitting down and developing a proactive strategy around how to keep your pet healthy and not look just a month or 2 or 5 down the road, but a year or 2 or 5 years or 10 years down the road based on your pet's genetics, based on their lifestyle, based on where you live and what you feed and what their risk factors are. Veterinarians are just not very well equipped at all, either from a knowledge perspective or perhaps more importantly, from a time perspective to answer those questions. Why is that the case? Well, in large part, over the last 10 years, Jess, it's because my little profession has been overtaken by corporate acquirers. And when I first got out of school way back in the dark ages, every veterinary clinic was owned by an individual, male or a female, husband and wife, wherever you wanted to go. But these days, over two-thirds of veterinary practices are owned by corporate businesses, including the Mars bar. You know, the same people that make Mars chocolate bars for you and me, they are actually the single largest owner of veterinary practices in the world. And what that means, though, Jess, very practically, is that they are hiring veterinarians directly out of school with very little experience because those are the veterinarians they can pay the least. And those veterinarians, fresh out of school without any practical experience, are being told, hey, you can only spend 15 or 20 minutes with a client. You have to use these medications. You have to recommend these vaccines, regardless of what that dog or what that cat needs. And most importantly, here's the way we're going to pay you, Mr. New Veterinarian or Miss New Veterinarian. We're going to pay you, I don't know, let's pick $100,000 as a starting salary, but we're going to give you 21 to 24%, which are accurate numbers, of every dollar that you make for the veterinary practice. And so if I told you, Jess, that on the one hand, as a veterinarian, I could only spend 15 or 20 minutes with you. And on the other hand, I'm being reimbursed for the money that I charge you. Basically 25 cents of every dollar that you spend at the veterinary clinic will go back into my pocket. Where's the incentive for a veterinarian to talk about longevity, to sit down and sit down with you on the floor and spend the next 20 minutes or a half hour, or 45 minutes or an hour talking about things that aren't going to make them any money at all versus giving your pet a vaccine or recommending a dental or whatever the case may be that puts 25% of every dollar back into their pocket. There is a disconnect that has developed. We are not the relational, I mean, I may never have been the world's best veterinarian, Jess, but I was a pretty darn good relationship builder. And if you and your dog walked in the door, I would have given you a big hug. I would have shaken your hand. And you and I would have spent 5 or 10 minutes with me just sitting on the floor talking about life as Jess before we ever got around to your pet. Those days are done. Veterinarians these days don't have the time and they don't have the economic incentive to really concentrate on building a lifestyle strategy, excuse me, a lifetime strategy for your pet. That's why I do what I do. I'm retired from clinical veterinary practice. My time is my own, and you and I can take as much time as we want to discuss the true lifestyle, genetic, and dietary risks and how best to avoid them for your pet.
That is something that is absolutely missing. I remember when I was younger, like young, like before I could even drive, we went to a veterinarian who literally practiced out of what was an old house. Everything else had built up around it, but it was this tiny little old house, and all of the bedrooms were exam rooms,
Mhm.
and the like, where you walk in would be, like, the living room, dining room area, that was reception, and it smelled like a vet office, and it looked like a vet office, and it was old, and it was dusty, but he knew everything about you, your family, and your pet when you walked in. And it wasn't until I became an adult, I was, 18 years old, I got my own pet for the first time, and I started having to go to a different veterinarian because now these are my pets and I'm in a different city and blah, 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 that I was like, "Oh, this is totally like, these are sterile environments, they are you're getting next to no time with a veterinarian." Fortunately for a while, I did get to have a relationship with just one veterinarian, and it wasn't like you're seeing a different vet every time you walk in, which in itself is just not good for your
Yeah,
pet.
it's a very common problem these days, and you're exactly right. I mean, one of the concepts that allows for best care, whether you walk on 2 legs or 4, is case continuity, so that you're seeing the same doctor every time you go to the OBGYN or every time I go to a urologist or whatever, but especially every time your pet goes to a veterinarian, because the reality is that eh, there is value to having history with a patient, to being able to watch the changes as Jess or as Kevin or as your dog goes through their life. Because I mean, it just makes intuitive sense. And that's another thing that has gone by the wayside, unfortunately, in both human and veterinary medicine.
Yeah. Well, and I think the financial aspect of it that you brought up is very real, but it's also one of the reasons that gets pushed back so much in at least in the veterinary circles that I'm privy to, because the reality is these are largely holistic and integrative veterinarians who do everything they can to spend as much time with their patient as possible, have an insane
Right.
amount of empathy for their clients, human, two-legged and four-legged, and so they just truly have the and know that everybody going into veterinary medicine, going into vet school, they all have these, like, amazing ideals of, "I wanna help animals, this is what I wanna do," but the reality when you get to the other side of vet school with these massive loans and, all of the things, it is I can imagine it's very overwhelming.
It can be. It can be. I don't pretend to be able to speak to the student loan demographics, but the reality is, there's a clear reason that veterinarians, they graduate from school and go to work in some of these corporate practices because they can make more money. They can provide for their family. They can provide, they can take care of their student loan obligations. And so I'm not belittling them in any way, shape, or form. It's just that we as a profession, Jess, have kind of lost our way on some of the really important, just the foundational pieces of being a doctor. But the veterinarians that are coming out of school today are making exactly the same decisions that you and I would. It's just that they're moving into a different society than existed a few years back.
Yeah, yeah. So, okay, got that out of the way.
All right.
And unfortunately, that leaves us back to where we are in reality today, which is that pet parents, in my opinion, pet parents just have to be they, they have to be empowered. They have to be the head of their pet's care team, and they have to be able to talk to and trust their veterinarian. Probably in today's day and age, have more than one veterinarian because there aren't holistic and integrative veterinarians everywhere. You're going
Yeah.
to have somebody that can put their hands on your animal, run blood work, do diagnostics, and then probably somebody else that can help you interpret them and create a plan that actually aligns with your value set. So, how do you coach people through that process?
Well, I guess what I would say is the single most important, and if I were to cut to the chase in what you said, as a pet parent, I'm gonna take one step back. I'm 66, and so, I'm a little bit, now mortality plays a little bit more of a role in some of my lifestyle choices than it used to. And so I very much believe that whether you walk on 2 legs or 4, you are obligated to be the head of your healthcare team. The reality is that, one of the things that my girlfriend and I talk about quite frequently is our parents were trained just simply to blindly obey a doctor's orders. And I think sometimes that served them well, but many times it did not. And one of the things that I always coach my clients on, my pet parents, is ask your veterinarian why you're getting this vaccine, why they need this blood test, or whatever the case may be. And your veterinarian ought not to take offense at that. You ought to be able to sit down and have a conversation and say, well, listen, this is what I believe. This is what I believe your dog's risks are. And this is why I'm going to vaccinate accordingly, or why they need this surgery, or why they need this blood test. And if your veterinarian reacts poorly to that, then you probably do need to find another veterinarian, because I would suggest to you, Jess, that the primary role of any doctor, again, whether you have MD or DVM behind your name, is to act as your partner in this journey that's called healthcare. And so you ought to be able to talk to your veterinarian. You ought to be able to ask questions, and they ought to be able to ask questions of you, sometimes with emotion behind them. But you guys ought to be able to coexist and be pals, because we're all in this together. And I mean, your goals as a pet parent, Jess, are no different than mine as that pet parent's, yeah, as that pet's doctor.
Totally agree, and you know, even people my age, well, because I, of course, learned from my parents that you blindly trust a doctor, that you blindly trust your veterinarian, and for me, and I've said this so many times, when I was in my early 20s, I thought I was being the best pet parent that I could possibly be by following every instruction that my veterinarian gave me to the T, to the point where I had 4 different cats on 4 different Royal Canin recipes because she said they each needed a different
Gosh.
one.
Yeah.
Right? So, like, but
That had to be a
this is
pain in the butt for you.
oh my gosh, yes. Um, yes. But that was what I thought at the time was the best I could do for my pets, because why wouldn't I trust this person of authority? I think we are very fortunately in a day and age where people are no longer, many people, some people still are, but many people are no longer blindly trusting authority, but it is still very difficult in today's just society, the way the world works right now. You got a job, your husband has a job, or, vice versa. You've got kids, they've got extracurriculars, and then you've got your pets. And how much bandwidth do you actually have to put into
Yeah. That's fair.
figuring all this out?
Yeah, that's absolutely fair. Yeah, it's hard, and that is the reason. I'm gonna circle back around. That's the reason that I opened this concierge practice that I have, because I want people to be able to deal with their pet's health on their terms and on their timetable, instead of the 9 to 5 that your veterinarian typically is around. And so I answer phone calls, I answer texts, 7 days a week, and that's important, because the reality is that everybody does have a timetable. I mean, you have a life, I have a life, and sometimes it's easy to let the non-critical things go, but those non-critical things just add up, whether you're talking about your kids' health or your pet's health. And so it's important to have that partnership, that relationship that you can rely upon to get questions answered in a timely fashion.
Okay, so we talked earlier about you're completely on board with a whole food diet. This is, for me, still, our dogs and cats are different. I don't know how you feel about it. I prefer, even more so than dogs, I prefer cats to be on a raw food diet. I think that, the Pottinger experiment kind of showed us how different cats will develop, especially through, I can't think of the word I'm looking for,
No,
as
you're
they
good. You're
breed and
good.
different,
Relax.
like they're
So,
just not, there's detriment to feeding cooked foods to cats. That was shown pretty well extensively in that study. And we have a little bit more leeway with our dogs, I think. While I am a proponent of a raw food diet, I also am a proponent of a home cooked diet, or, a cooked diet in general. I know my dog, she told me very clearly about 2 years ago, she was no longer really wanting to eat raw food, and we kind of went back and forth. I did some HPP raw for a little while, that kinda held her out, and now she's pretty well decided she wants cooked food, and at her age, if that's what she wants, that's what she wants. But generally speaking, feeding a cooked food, yeah, I mean, feeding real food to our pets, we now have the studies. We know there is benefit to it. So addressing that, addressing the environment, the toxins in the environment, all of the things, where do you go from there, when you are working with a client? We talked a little bit about, you have supplements that you probably have,
Yeah,
like,
well,
across the board would
yeah,
recommend.
so I can run with that, and so I'm gonna hit a couple of the high points for you that you just spoke about, because really in my line of work, probably the single most common dietary problem is too much, is
Mm,
pets who come in obese. And so one of the things we know, Jess, that across species lines, whether you're talking about fish or elephants or alligators or dogs or cats or humans, is this. And that is that the best way to increase your lifespan is to reduce your calories, realistically. And that's been shown time and time again, most eloquently by the Purina company back about 15 years ago, where what they did is they took litters of Labrador Retriever puppies, and half of those litters they fed as much as they want, which for a Labrador Retriever is a lot, and I speak as an ex Labrador Retriever dad. And then the other half of those litters, the very same genetic brothers and sisters, they fed about 75% of their maintenance needs, and that continued for as long as these dogs lived. They were in the same environment. They were given the same vaccines. They were given the same food, just different quantities. They were fed by the same people. So there were no changes whatsoever. And the thinner dogs, the dogs who were fed at 75% of maintenance, actually lived 1.8 years longer than their heavier brothers and sisters. And so that tells us right there that every bit as important as nutritional quality is nutritional quantity. And so, in both humans and pets, we're realizing that there are just huge benefits to avoiding obesity. And interestingly, it's one of the diseases, one of the problems that people just hate to recognize in their pets. I'll tell you a quick story because I ran a fairly big practice here in San Luis Obispo, California for some time. And we had about 5,500 patients. And so this was about 10 years ago, kind of at the height of the Biggest Loser type TV shows. And I thought, golly, Jess, I'm going to create a contest, and I'm going to offer the pet parents $1,000 for the winner of the Biggest Loser pet contest. And I set up a dietary program and an exercise program, and I sent out 5,500 emails. You know how many emails I got back from people saying, "Okay, my pet is fat. I want to be in your Biggest Loser study"? Zero.
oh my
0,
goodness.
not one.
Oh.
And so, unfortunately, I mean, there are a lot of different psychological reasons, I suppose, for it. But pet parents need to understand, again, let me repeat, that it's not just nutritional quality, but it's nutritional quantity as well that'll play a role in your pet's health span. And the other component, I'm just going to hit on this before we move on to the question that you actually asked. But when you and I talk about lifestyle, there are clear changes that you and I can make that will benefit our pet's health span and how long they actually live. One is the fact that every time, especially if you have small dogs, every time a small dog or a cat goes up and down a set of stairs, they are shortening their life. Think about some of these small dogs, kids, or these cats. They're 12 to 14 to 16 inches tall. We're asking them to go up and down 8-inch stairs time after time. That's like, I spend a little bit of time at the gym and I'm 6 foot tall. That'd be like me jumping repeatedly, doing a box jump, 3 foot up, 3 foot down, 3 foot up, 3 foot down. So think about the wear and tear on your pet's joints, on your pet's spine, excuse me, as they go up and down the stairs on a repeated basis. One of the cheapest ways for you to extend your pet's life is simply to buy a child's gate so that your pet maybe goes up once or twice, but not every time you go up and down a set of stairs. Another example of lifestyle, Jess, is just simply the slipping and falling. I would bet that when you get home from work, if you have hardwood or tile floors in your house, that your pet has a traffic pattern. They're going to run down the hall and turn left at the kitchen and then turn right at the hallway. And every time they do, sometimes they'll slip and fall as they turn corners. Every time your pet slips and falls, they're shortening their life. So if you and I were building a home together to maximize our pet's health span, maximize our pet's lifespan, it would be a one level house, Jess. It would have carpet from one end to the other, or some other way of ensuring maximum traction. But if you already have hardwood floors or tile floors, well, sacrifice your old yoga mat to the equation. Put it on the floor where your pet changes direction. Go to Walmart, buy a $20 throw rug with a rubber back on it. Keep your pet upright, keep them from slipping and falling, and you will extend their life. And so I'll take a deep breath here because that wasn't really the question that you asked. The question is, where do you go from here? But these things are really important because I'm going to tell you that it's very easy for me, Jess, to spend $300 or $400 of your money each month by using fancy drugs to help extend your dog or your cat's health span. But the reality is some of these things you can save money by feeding your pet less. You can spend $20 to buy that child's gate. You can buy $20 worth of throw rugs and make probably a bigger difference for your pet's health than a schmo like me with a handful of drugs. Does that make sense
That
to you at all?
it Oh my gosh, yes, and that is so important to be able to manage the environment for them. I
Yeah.
know when I moved into my house in Texas, it was all hard floors throughout, and that was intentional because I don't like carpeting. But then knowing that my dog she needed traction, I put rugs everywhere. And you're right, there were some areas that I used yoga mats in, and I even lined there were certain windowsills that she liked to sit in that I lined with white yoga mat,
Yeah, absolutely. Absolutely.
to
You know,
make
and
it
when
a more hospitable environment for her.
Yeah, and simple little things like, when you and I take dogs for our walks, well, if you look around in a grassy area and there are no weeds, then you have to ask yourself, why aren't there any weeds? Is this golf course, is this park using Roundup? Is it using weed and feed type products, which have been proven toxic to humans? And, I can
Mhm.
speak very directly to weed and feed products creating a problem for my old golden retriever. And so, where you exercise your pet and how you exercise your pet is another vital component of helping them live as long as possible.
Yeah, I know. I mean, you have a puppy, which, I mean, good for you for especially
Most
you're
times anyway.
retired. Like, why yeah, as a retiree, I don't know why you would be like, "Let me ruin my life with a puppy." No, all joking aside, you do want to expose them to all different types of surfaces, all different types of people, all different types of places, that's good socialization as a puppy, but, as they get older, it just like we see with, like, runners, it's really damaging to our knees if we are pounding asphalt constantly, day in and day out, and so being able to walk I know I have some clients that I have had them intentionally walk their dogs in grassy areas versus
Sure.
on a street or
Absolutely.
on a because they're older, they have hip problems, they have joint let's not add to that.
Yeah. Yeah.
So
No, you're
that is
100% correct.
important,
So, yeah, we've
important.
talked about two legs of that longevity chair. We've talked about diet and lifestyle.
Mhm.
We've talked a little bit about prescription longevity drugs, but the reality is that the next one is traditional veterinary care. But it's traditional veterinary care just with an asterisk. And by that I mean when I graduated from vet school, I was told every pet needed a vaccine once a year, no matter what. And now we know that over vaccination is one of the most significant ways that your veterinarian's care can actually worsen your pet's health span. We know clearly that extra vaccines can create problems for both dogs and cats. And I speak as somebody, Jess. I went through the original parvovirus outbreak back in the late
Mhm.
1980s, and parvovirus killed basically every dog it came into contact with. It was the dog apocalypse. So I want to be clear about one thing. I believe in the benefits of vaccines when they are used appropriately for pets that are at risk. I also would tell you very personally, I went through a 32 shot rabies vaccine series at one point in time because I was bitten of all things by a suspect rabid cow back in the day. So I understand the logic of having rabies vaccines, not only for me as a veterinarian, but also for the pets in our care. And so I'm not in any way or shape anti-vaccine, and especially in today's political climate, I want to make that 100% clear. But I would suggest to you that if you have an inside cat, maybe you shouldn't be vaccinating against outside cat diseases. Why? Because every time I, as a veterinarian, poke a needle through your cat's skin, I am exposing them to the risk of skin cancer at the site of that injection. And I would tell you that I know that I have killed 7 cats at least over the course of my 40-year veterinary career by vaccinating them and trying to help them. I inadvertently hurt them and shortened their life. So listen, I mean, I'm 100% in favor of vaccines when justly used to solve identified risks. But there are both dog and cat vaccines that are not needed, and their use may create risk for your pet. So I'll stand down off of that soapbox and I'll hop right up on another and say that for small dogs and cats, the single best way that your veterinarian can help you extend their life is with anesthetic dentals on a yearly basis. And people will squall, people ask about non-anesthetic dentals. Well, listen, guys, non-anesthetic dentals just don't work. Why? Because you can put the world's best trainer on your dog or on your cat in theory. And no matter what, they're not going to lay still while a veterinarian puts a dental x ray plate into their mouth and tells you to wait 30 seconds while I trigger this exposure. But unfortunately, for both humans and for pets, guys, the only way that you and I can look underneath the gums and actually solve infection and solve pain is with dental x rays. And so if you have a pet that is under 25 pounds, whether that pet is a dog or a cat, I'm telling you that the very best way you can spend your money if you're looking to maximize your pet's health is with annual dental anesthetic. Excuse me. Let me try that. Annual anesthetic dentals. Okay, that now I'm off my second soapbox. Boom, I'm done.
No, I appreciate that. I've actually had, a couple people talk about that. Dr. Katie Kangas is, one of her passions is in dental care for pets, and she's in, San Diego. One of my favorite people in the whole world, and she, yeah, we've talked extensively about how much we do not like or appreciate non-anesthetic dentals,
Yeah,
because most of that periodontal disease is under the gum line. And you're not touching that if you're not doing anesthesia
yeah,
on an animal.
yeah.
You're not doing it. And yes, those X-rays are very important. You have no idea what's going, like, your roots could be dissolving and you have no idea. Like,
Yeah, that's very true, and I'm gonna go out on a limb here, and I speak as somebody, Jess, I had no dental education when I graduated from veterinary school back in 1986, not one class. But along the way, in the late 1990s and early 2000s, we realized how much schmoes like me were missing, and so I took class after class. I went to see continuing education course after continuing education course, and I'm gonna tell you this, I'm gonna tell you that if your veterinarian is not taking x-rays of your dog or your cat's teeth under anesthesia as part of a dental procedure, there's a Latin word for that. And that word is malpractice. Every veterinarian ought to be doing that because if they are not, they are missing diseases which are going to cause your pet pain and shorten your pet's life.
yeah. I had a cat who I knew he had resorptive disease, so he went in every 6 months
Yeah, really.
for, anesthetic dental cleanings, and we got to the point where he was doing really well, and my vet said, "Let's extend it to a year." We extended it to a year, and then I don't know what it was after that year. I went back to a 6 month, and sure enough, he was getting older, and he ended up on that next anesthetic dental. He had 17 teeth removed from the resorptive disease, like, just
Yeah.
that quickly, like,
Yeah, and
in
that's
that
a
6 month period of time.
horrible, I mean, cats, it's one thing to see periodontal disease in dogs, and I can tell you times where I have removed 12 or 14 or 18 teeth from a dog's mouth, and their pet parent comes back 2 weeks later and says, "What did you do to my dog?" This is the happiest they have ever been. in their whole life. And what I did, I didn't add anything to them. I subtracted pain from the equation for them. But I would
Yeah.
tell you that cats, bless their little hearts, are poster children for two of the most painful diseases that anybody could ever imagine. The resorptive lesions that you just spoke of. And guys, if you're not familiar with it, it's like me taking a drill and just drilling a circular hole into my tooth right at gum line, all the way through the hard enamel layer down into the sensitive dentin where the roots live. And that's what these cats' teeth look like. They just have little holes that have been drilled into them by an overactive immune system. Can you imagine how painful it is to have one or two or 17 teeth, Jess, that are actively bleeding and actively have nerve pain? I mean, it's got to be horrible. And a second disease that we see are just the gingivitis type issues, the stomatitis, where it looks like somebody just took a Bunsen burner to your cat's mouth, and every surface in their mouth is inflamed. And the only way to solve this is typically by extracting every tooth in their body. So please don't, whatever you guys do, if you don't listen to anything else I say, please understand the emphasis on dental disease for these pets under 25 pounds.
Yeah, it really is damaging. Fortunately, he did really, really well after, he had those teeth removed, and he ended up getting, I didn't know it, he broke his leg one day, and I took him in and got it X-rayed, and we found hemangiosarcoma. So
Oh,
my poor Romeo just had the worst luck, of any cat I think of, well, maybe that's not true, but anyway, um, my poor guy. But he even after that, like, I kept him comfortable for a little while with, CBD with extra THC, and we managed for a little while,
sure.
but ultimately, it was just it was his time, and I hate that so, so very much, and I don't wanna go down that road because now I'm starting to get emotional. But
Good.
yeah, you're absolutely right. I'm such a huge proponent for anesthetic dental, so absolutely scream it from the rooftops. I get so frustrated when I go by a pet store that has a sign out front that says, non-anesthetic dental
Yeah,
cleanings next
I've
Saturday. What
seen.
I'm just like,
Yeah,
please. I mean,
fully agreed.
honestly, in the same way that I go by the pet store that has, rabies vaccines for $10, and I'm like, stop it. Stop it. But, that's a whole other thing. Um, so, okay, we've addressed, well, we haven't really addressed the longevity drugs, but we can kind of leave that to the end if you're okay with that.
Yeah,
We've
and so
talked about
let
it a
me
little bit.
okay, so I'm gonna interrupt, and I apologize for this. This will have to be
That's
we'll
okay.
take time out and edit this one out because number 1, my dog is barking. Number 2, I need to grab a power cord really quick.
Oh,
So
yeah, go for it.
so I apologize.
That's okay.
Take a deep drink, and I'll be right back,
No
okay?
worries.
Alright. I apologize for that. That a little unprofessional
Oh,
on my end, but I've been busy all day long, and so away we go.
no,
Alright, so yeah, we can
no
talk about
problem.
supplements or longevity drugs or wherever you want the conversation to go.
Yeah, I mean, we can talk a little bit about the longevity drugs, but I think, supplementation might be a harder for me, harder topic to broach because I really, really struggle with supplements. Not that there aren't some that are absolutely beneficial, but just in like the overwhelm of the
Mhm.
supplement market, right? I mean, people ask me all the time, well, like students that I mentor, they ask me a lot, like, if you could only pick 3 supplements, and I'm like, let me see the now my animals are barking.
No, not to
Um,
worry.
le and I mean, my initial thought, I'm sorry, let me let them get out of the way.
No, you're good. You're good. Yeah, I took
I
a
my
minute,
my
so
in yeah, my
go ahead.
initial thought when somebody asks me that is, like, I really need to see the animal in front of me, like, to be able to address, like, what are my top 3 supplements. I think, though, like, at the end of the day, and I wish this weren't a supplement, I wish this were actually better built into our diets, but omega-3s, balancing out the omega-3s to omega-6s to like, making sure that we have a really good balance there because as you said earlier, obesity is, like, the number 1 disease, and it's causing so much inflammation in the body. Inflammation causes it's the beginning of every other disease.
Yeah,
So if we're
no
mitigating
argument.
that at all, by balancing our omega-3s to what inevitably like, just our world, we in our food, we're subject to so many omega-6s, not that they're the devil, but, like, we need to balance them. So,
Yeah,
what are
absolutely. And
what are
so,
your thoughts?
you know, let's talk for a little bit about supplements. And you're absolutely right. I mean, the unfortunate truth, Jess, is that there's tremendous amount of just, well, I'm going to use the word bullshit on
Yeah.
in both the human and the veterinary supplement market. And
Mhm.
it's a billion-dollar industry with a B. And so we have to understand that anytime there's that kind of dollars associated with it, the unfortunate truth is there's ample room for people who don't know what they're talking about or who are just trying to make a dollar at somebody else's expense to uh, to promote their supplements. And the bigger issue, though, is that science changes, Jess. And so here's another example of Kevin being wrong. For 20 years or so in my veterinary practices, I sold glucosamine and chondroitin products like Cosequin and like Dasequin, to virtually every painful pet that walked in the door. Well, here's the deal. Now science tells us, Jess, that glucosamine and chondroitin products simply do not work for either the inflamed joints of humans or the inflamed joints of pets. They don't work. And so, as science has evolved, you and I have had to learn that products that we recommended some time ago are simply not effective. Another example of that is resveratrol, which is commonly used, especially in humans. Science has proven that not to work. It's just been absolutely disproven from the very beginning. And so, if you and I look at supplements through the lens of science, what has been proven to work, that should be the first step for any of your listeners, because there are times when your pet does need supplements. There are times when a pet's diet or a pet's lifestyle alone is not adequate to support them, especially as they age. But let's use supplements that are based in science. And what you said earlier, Jess, absolutely resonates, because the reality is that so many people want a blanket supplement regimen, or for that matter, longevity drug regimen. Take these 5 products across the board, and you'll be fine. You'll live happily ever after. Let me be clear: that does not exist whether you're a human, a dog, or a cat. And so, in my practice, I believe in prescribing supplements, not so much, as a prescription drug, but more importantly, using supplements that are A, proven in science, and B, are specific to that pet's needs. If your pet has allergies, let's use X, Y, and Z, including the fish oil that you've spoken about. If your pet has arthritis, let's use X, Y, A, B, and C on this dog or this cat. And so the days of recommending one supplement for either humans or pets across the board are gone. If I had to choose one, I would not argue with your fish oil. But beyond that, every pet and every human ought to be treated as an individual. And that's going to give you the best results with your supplement strategy.
Mhm. I completely agree, and it's unfortunately made me because I have this question posed to me literally on a weekly basis, and so it makes me think about it a lot, and, I mean, there are things that I wish that we could all have, well, at least our pets, our dogs and our cats, like, and I am that, like, woo-woo hippie girl that I'm just like, "Okay," like you said with the broccoli, "Let's grow some broccoli sprouts because they have increased sulforaphane in them and than just feeding the broccoli heads from the grocery store," or, if you're worried about taurine for your cat, let's throw in some extra chicken hearts and like, that's kind of where my brain
Mhm.
always goes,
Sure.
and, um, I wanna do that, like, first for for all
I
of
understand.
my
But one
animals,
of the
and then
things, let me play devil's advocate here, and you
yeah.
can edit this out if you choose. But
No.
the hard part is that, listen, and, I'm at a point in my life where I go to the farmers markets. I buy fruits and
Right.
vegetables from the farmers markets whenever I can. But not everybody is at a point where they can buy food from a farmer's market or home cook for their spoiled golden retriever puppy like Annabelle, or feed chicken hearts to their cats to increase their taurine levels. And sometimes you have to get those out of a bottle. You have to you get a supplement or a nutrient out of a bottle. And one of the things that I've learned is it's pretty easy for me to stand up on these soapboxes, as you've already learned, and start preaching. But I try like hell to meet folks where they're at. And sometimes, I mean, if we, yeah, and you and I can talk all day long about dietary quality, but the reality is sometimes people just need to do the best they can with a kibble diet. In which case maybe we talk about, well, feeding fewer kibbles and adding some frozen peas in, or frozen, whatever the case may be, anything to get away from the negatives of kibbles. But there are times when you and I would reach for a natural product or a more expensive alternative, but some pet parents just need to do the very best they can, and by golly, if it's a bottle of taurine, it's a bottle of taurine. So
Yeah, no, you're absolutely right. We absolutely have to meet people where they're at. And one of the things, and I'll just bring this up since we're on the topic of supplements, I have been very, very reluctant in the past, probably year and a half, maybe 2 years, to recommend probiotics to dogs and cats. Not because I don't think they're beneficial, I absolutely see the benefit in them, I just think we're using them wrong. That we're giving them the same strains, the same handful of strains over and over and over again and creating
I think that's
dysbiosis
fair.
in that
Yeah.
way. So there are 2 studies that I just wanna, like, mention really quickly that we have had come out of my little space in the healthy pet world. One of them being the benefit of, a certain mushroom blend that has some lion's mane and a couple others in it on canine cognitive dysfunction,
Mhm,
which has been very beneficial. I personally, I'm such a huge fan of mushrooms, for so many
mhm,
reasons, and getting them in our animals any which way we can,
mhm. No
whether,
argument.
if they'll take a
Mhm.
powder, great,
Yeah.
a tincture would be better, and then if we can feed them, steeping teas out of them, like, all of the things, like, let's do it
Mhm,
all. I love mushrooms. And then more recently, we just got a, study on a very specific probiotic. So, Green Juju is the company. They make 3 different probiotics, but they are ferments that of real food. So one of them is on raw goat's milk, one of them is on their, one of their green blends, so it's a bunch of different vegetables, and then the 3rd one is on a kombucha SCOBY.
okay.
So they're growing these bacteria off of these ferments, and then the laboratory is then taking and growing those bacteria, straining out the food source. So we're not getting those food sources in it, which can, especially for dogs that have a lot of food sensitivities, we're not introducing those food sources back
Okay.
in. And so they just came out with a study showing pretty significant using like cow protectin, what were the others? I'd have to go back. Whatever Innovative
Yeah,
Pet Lab
so I'd love for
studies,
you to
like
send
the
me that study, by the way, because I would tell you,
yes.
and it sounds like I'm not as smart as you around probiotic use. I do think that the combination of pre and probiotics has a definite place in GI disease, and one of the things we're
Yeah.
learning is how important GI health is. What a difference a good probiotic can make, not just to GI health and how you poop, but to your brain health and to
Mhm,
inflammatory disease like arthritis or allergies outside the GI tract. And so one of the things we're doing more frequently in my little practice is we're doing actual microbiome tests
mhm,
where we send a sample of a pet's poop off to a company and they analyze it. And, if your pet is deficient in this bacteria or this protozoa, they actually have supplements these days. I mean, back in the old days, you and I would have had to have talked about that proverbial fecal oral transplant, which just carries all kinds of negative connotations. But now they have actual pills that you can use, and if you're deficient in bacteria A or protozoa C, you take pills to go ahead and remedy that. And so
mhm,
I think that this microbiome, excuse me, let me try that again. Microbiome testing, probiotics to prebiotics, I think that there is benefit, but I think that you have to again, I mean, it seems like a standard refrain for you and me is you have to know exactly what you're trying to solve, and you have to work with science to give your pet the best individual results possible. The
mhm.
days of just picking a probiotic up, picking a box of Fortiflora up from your vet or whatever, I'm not sure that that's entirely in your pet's best interests.
No, I agree. And what's interesting with this study, and I will, it's so new that they don't even have it like, it's written up, but they're trying to make it look pretty, so I'm waiting to get the final from him.
Yeah,
But, and I'm happy to send it to you, but it's like, they're looking at, calprotectin, zonulin, pancreatic elastase, and a couple of other things in the gut, but they're also, as you mentioned, they're doing the, like, observable changes in the
mhm,
dog, and
yeah.
there's improvements in anxiety, there's improvements in allergies and paw licking and all
Yeah,
that, like, all of those.
absolutely, and it makes sense. It makes sense when
Yeah,
you think about it.
it
So,
really does.
yeah, and then
So
in the last couple of minutes, I'd love to just chat about
yes,
prescription longevity drugs for just a second,
yes.
and so, um, and again, I guess I would tell you that I take rapamycin as an example, and I take acarbose both, because it's more important to me as a 66-year-old than a 30-year-old like you, and so, but the hard part
That's
is
very
that
kind.
that in veterinary med, I mean, realistically, these are at best it is trickle down science from the human side. And even in human medicine, the reality is that longevity science, we don't have accurate blood tests that we can look at to define your actual body age or my actual body age. We have, I'm 66, I understand that, but how is my body age through the years? Am I looking optimistically, my body's at 56, or am I looking pessimistically, my body's at 76, which is the way it feels sometimes. We don't have the test to fully understand our body's aging, whether you walk on two legs or four. But there's pretty clear evidence that two products in particular do have longevity benefits or health span benefits. The first is rapamycin. And in every species studied to date, it's shown a survival benefit, a longevity benefit, and we think that it's modulated in three different ways. One is by reducing cancer incidence, one is by reducing inflammation, and the third is by supporting heart function. And I can speak very directly, for instance, to the benefits of rapamycin for kitties with heart problems. And then the second drug is acarbose, and that's even a little bit more interesting because it's a diabetic drug for Pete's sake, very commonly used in human medicine. But one of the things they found is that one of only 9 or 10 products that have been proven in studies to actually increase lifespan. But here's the deal, just in males, just in males. And so when used in combination with rapamycin in males, it seems to increase lifespan by an additional 5 to 7%. And it seems to exert those benefits just by reducing blood sugar. One of the third or fourth thing that I would ask your clients to understand, and after I get done shooting my mouth off, is this: the higher your blood sugar is, guys, in general, the shorter your lifespan is going to be. So acarbose, as an example of an effective longevity drug, acts by reducing your blood sugar. And so it's the difference between you and me eating donuts and existing on that broccoli that we've spoken of a couple of different times. So there's pretty substantial evidence right now that both rapamycin and acarbose can extend our pets' lives, in theory, by up to almost 20%. Now, I don't know if I buy that, but anything that will reduce cancer incidence. And let me be clear, I have personally seen the benefits of rapamycin therapy in cancer patients. I can attest to that all day long on the Bible of your choice. Uh, but if you and I can use a combination of longevity drugs in combination with the supplements we've spoken about, the diet and lifestyle, the dentals and diagnostics that we've talked about. I mean, you and I can make a huge difference for the pets we love. And I don't think it's unreasonable to think that you and I can extend dogs' lives by up to 2 years or so. And I don't think it's unreasonable to think we can extend lives of cats by a year and a half to 2 years. So let's do it. I mean, I'm so passionate about this because these are things that your pet parents, your listeners, these are changes that they can make beginning right now that will enable them to spend more quality time with the pets they love.
Mm. I have 2 questions. The first
Go.
one is how do you utilize fasting with your clients at all? With Not cats, but with dogs.
I do. There are times, yes. And one of the things that's interesting about rapamycin, for instance, this prescription longevity drug that I spoke of, is that it mimics fasting. It mimics calorie restriction on a physiologic basis. And that's one of the ways that we get the cancer resistance that we do. And so, yes, I think that the fasting, again, it ties back into the whole dietary in the discussion that you and I had earlier, in that I think that in both humans and pets, there's clear evidence that the benefits of time restricted feeding, and some people mistakenly call this intermittent fasting, which it's not. But if you and I can compress the hours that we eat, or that my little puppy Annabelle in the background eats, into a 6 or 8 or 10 hour period, leaving us at 10 or 12 or 14 or 16 hours of fasting, there is survival benefit. There is weight benefit to that approach. And so you're absolutely correct in making that assessment.
Yeah, well, it's something that I'm very interested in, not just for dogs, but, for myself as well. I definitely feel better when I fast and when I compress my eating
Mhm.
window, especially, when I do that, just a daylight hours kind of thing, kind of
Yeah,
keeping
absolutely.
keeping in line with circadian rhythm, but sorry,
Hmm.
go ahead. Go ahead.
No, I'm agreeing with you. I many times find myself eating early and eating late because
Mhm,
I get busy during the day. But the
mhm,
reality is that I don't sleep as well. I just don't feel as good as if, in a perfect world, if I could eat dinner by 6 o'clock each night. And a lot of times I do skip breakfast or eat it relatively later in the mornings. But I think there's clear physiologic benefit to the time restricted feeding, no doubt about it.
mhm. The second question is, when do you actually bring these pharmaceuticals into a care routine? Because y everything we talked about prior, like, that takes a lot of effort and a lot of for most pet parents, it takes a lot. It's a big
Yeah.
dedication piece. Even talking about fasting, like, I actually find that to be one of the harder things pet parents do because
Yeah,
it's
I mean, and
like
that's the hard part, is that, there's study after study on the human side that talks about the benefits of fasting. Well, how many people actually fast?
Mhm.
2%, 5%, whatever the case may be, because it's a little bit painful, I mean,
Yeah.
you don't, at least, and I've fasted accidentally for a day or two from time to time, and it's not really all that much fun. And so, it's hard because you and I equate feeding our pets with loving our pets. And,
Mhm.
that's a difficult transition to make. And the larger question you've asked, though, is this: should we leave things like prescription longevity drugs as a treatment, or should we use them as a preventive? Because, if I look at rapamycin, for instance, there's clear studies, Jess, that show that it reduces cancer incidence. So should I wait and take that after have run into a cancer incidence, or should I take that in an effort to prevent cancer? And my bias, as that 66-year-old, I'll take it as a preventive. But the hard part is that we're guessing at this. There are no studies to support this use. But I'm going to tell you that I think there is logic. If you and I just sit down, I mean, you're a smart girl, and I'm not as smart as you, but I got a little bit of training on my side. And I think if you use logic, why not start some of these proactive treatments? Let's treat our medicine. Let's treat our health issues. Let's treat our longevity proactively rather than reactively. And, I think that the functional health model, where you and I are getting our blood tested on a regular basis, so we catch diseases early before they become a clinical problem. We test ourselves for cancer early before it becomes a clinical problem. We make these dietary changes or these lifestyle changes early before our pet slips and falls, create arthritis for them. I just think that there's so much logic to beginning these as early in the game as possible, whether you walk on 2 legs or 4.
Well, that answers the question.
Probably
I
more
wanted
words than you wanted, so
No, no, you're good. I actually wish we had more time. I unfortunately have, another recording to get to, but I hope that you were able to get all of the information across that you were wanting to, and where can people find you if they have questions, if they wanna do telemedicine with you, like, how does
absolutely.
that work?
Well, thank you for that. And one thing you mentioned, Jess, I'd be honored to get on another podcast with you where we can sit and We disagree about more stuff. We can agree about things. We can answer some of your listeners' questions, whatever you'd like, because this is important to me, and I am passionate about this. So, in direct answer to your question, I do run a business called www.helpingpetslivelonger.com. Helpingpetslivelonger.com. And that's exactly what I do with my team. 7 days a week. We work on consults. We work on developing customized supplement plans and use the use of prescription longevity drugs, both on a preventive basis. And if your pet is dealing with cancer or heart disease or chronic pain, I can help you. But I also have a simpler website put together just for podcast listeners, and that is www.freevetcall.com. Freevetcall.com. And it's a one-page website, you guys. Click on that link. It'll put you into my calendar, and you can set up a free 10 or 15-minute consult on the subject du jour at no charge, whether that be vaccines, whether that be nutrition, whether that be cancer therapy, whether that be longevity. I'm honored to help you guys at freevetcall.com. There's no charge for it. It's just my effort to give back. You and I are all in this together.
Well, I love that. Thank you so very much. And guys, make sure to check out all of that information. Go to freevetcall.com and take advantage of that. That's lovely. Thank you for doing that. Thank you for spending your time with us today, Dr. Toman. And for me and for Dr. Toman this week, please give your pets some extra love. And I will talk to you next week. Okay, so here we are at the end of the episode, and the reality is that at the end of the day, I hope you know that I am not a proponent for pharmaceutical longevity drugs. Do I think that somebody somewhere may utilize them? Of course. I know people are going to utilize them. I just, I brought up fasting because it is going to produce the same outcome with autophagy in both humans and in dogs. That the drug, the rapamycin drug, is claimed to artificially induce autophagy in the body. This is something that we can do naturally through fasting. And I think it is much better to be able to do that through fasting. Is there a use case for the drug? I don't know. I don't know. It's not something that I think I would use, and it's not something that I think I would recommend. Um, I also don't think the studies are there. For dogs especially. I don't think the studies are there. But that brings up another topic that I'm gonna get to in just a moment. The second thing is I did not push back, and I wish I had, on the second drug that Dr. Toman spoke about, the diabetic drug. If we are feeding a species appropriate diet, why would we need to decrease blood sugar? Why would we need a drug, a pharmaceutical, to artificially decrease blood sugar levels if we are feeding a species appropriate diet? We talked earlier in the episode about feeding species appropriate diets. At least in my mind, I thought we were talking about feeding species appropriate diets, but I think Dr. Toman was speaking more on just home cooking, which oftentimes includes grains and legumes. And I'm not saying that there aren't use cases for those. In Chinese medicine, there are energetic properties to all kinds of foods, whether it is, you know, reducing stagnation or tonifying qi or tonifying blood or whatever it may be. Different foods have different properties. However, those, grains and legumes are not species appropriate. So if we are feeding a species appropriate diet, then why would we need a drug to artificially decrease blood sugar levels? So those are kind of the points that I really wish I had pushed back on a little bit more with Dr. Toman. Though I will say, when we got off of the call, he felt the pushback more than I thought I had given, because he made comments about hoping that the conversation was good and agreeing to disagree and things like that. So he felt more pushback than I thought I was giving. So maybe you caught that too. I don't know. I wasn't comfortable enough to put the episode out to you without providing additional context into how I actually see these things that he was talking about. That being said, to me, this brings up a whole other conversation around studies in general, because Dr. Toman talked multiple times about the studies. And the reality is that it has never been a problem of confidence in studies in both human medicine and veterinary medicine. Doctors have always been confident in the studies. The studies themselves have always been the problems. In the 1950s, you would go into a doctor's office, he'd be smoking a cigarette, you'd be smoking a cigarette, everybody would be like, this is great, let's keep doing this. Um, Now we know, granted, yes, there are use cases for nicotine and there are benefits to nicotine, but that's not the only thing that's in those cigarettes. And those other things, those chemicals and other things in those cigarettes are causing lots of problems. Obviously, we know that now. We have gone through so many pharmaceutical drugs that have been pushed on the population only to come to find out that it caused major damage to thousands, millions of hundreds of thousands, sometimes millions of people, um, because doctors said, yep, this study's good. I have been told about this study. I'm going to prescribe this drug because this study says that this drug is good for whatever is ailing you. I mean, look at, um, was it Vioxx? Look at, there were medications, I believe, for nausea given to pregnant women for years, and the birth defects that came out of that, that drug was pulled. By the way, none of these manufacturers have ever been held accountable in any meaningful way. Then we go to the opioid epidemic. Oh yeah, of course. No, that this is amazing for pain and there are no addictive properties. Yeah, right. How many millions of people in the US alone have been affected by opioids? In one way, shape, or form, including death, right? So the problem has never been about confidence in the studies. Doctors are always confident in the studies. The studies themselves are always the problem. And especially when the manufacturers themselves are the ones putting on the studies, or the manufacturers are the ones paying for the studies. That is always where the problem is. So, no, I don't, the doctors never think they're doing anything wrong. They're being handed these studies saying, look at what amazing things these drugs can do. So, I don't want to come here and say that Dr. Toman or any other doctor is willfully doing anything disingenuous or, you know, willfully harmful to any human or animal. No, I don't think that's happening at all. What I do think is that the indoctrination into the medical system as we know it today precludes doctors from asking questions. And I wish I had asked more questions of Dr. Toman, because not only when we got off of that call did he feel the pushback from me, but he asked me for more information on some of the things that I brought up, because he said, obviously you're well educated in these things and I would like to understand where you're coming from. So I credit him for that. I wish it were on film, but it isn't. I will credit him for that. So, no, I don't think that it is intentionally harmful in any way. I do think that the indoctrination into the medical system has taught our doctors on the human and animal side to not ask questions, to quote unquote believe in the science. because we have, and I've said this before, we have turned science into a religion, and it should not be. It is the opposite of a religion. It is the lack of faith. When we are appropriately conducting a scientific study, we propose a hypothesis and we actively try to disprove it. That is not how studies are being conducted these days. It is very unfortunate. The reality is that we just have to be aware of it. And we have to know that no, our doctors are not intentionally doing anything harmful. They have been taught, they have been indoctrinated by the system to not ask questions, to believe in the science, to trust the studies. This is why I get so frustrated when people ask for, they don't trust that, garlic is okay, or they don't trust that an herb is going to be okay. Is that scientifically proven? I mean, maybe, but do I give a rat's ass if it's scientifically proven? If it's working for my animal, if it's working for your animal, it's natural, is not causing any harm, let's do it, right? Whereas the side effects, which are just effects of the drug that they don't want you to pay attention to, I learned that um, with the degree that I did get in science, um, is there are so many of them. But again, they're indoctrinated to trust the science, to believe in the science, to not ask questions, to look for the studies and not ask questions of the studies themselves, but to just believe in whatever that thesis of the study, whatever the summary of the study says. Oh, this is good. Okay, that's all I need to know. I'm not reading the rest. I'm not reading who funded it. I'm not reading how they conducted the study. I'm not reading why they excluded X, Y, and Z or whatever. They are just blindly trusting it. And so this is where we are, where at the end of the day, the two quote unquote longevity medications that Dr. Toman brought up, in my opinion, we don't need them. We can fast and we can feed a species appropriate diet. And in both cases, we are going to, when we fast, we are going to create autophagy in the body. And when we feed a species appropriate diet, there's no need to reduce blood sugar levels. Outside of that, outside of that, I think, it was a good conversation around making sure that we are caring for our animals and extending their lives in a healthy way, that we are also extending their health span. So, thank you for sticking with me in this extra little tidbit at the end of this episode, because I really wasn't sure about putting this episode out, and being able to say these things to you makes me feel like the episode was worthwhile. That I was able to then explain a little bit more, at least my thought process in what I would think about these drugs. Um, is it true that people have a hard time fasting their dogs? Yep. It's also true people have a hard time fasting themselves. So, you know, the other thing that brings up is the fact that doctors have become very cynical with their patients. And I'm not even saying that's wrong. But what I am saying is that there is a definite shift in our society where there are people, more and more people every day, who are willing to do the hard things because they are the right things. And I think if doctors want to keep their position in society, they're going to have to come around to that. Their bedside manner is going to have to change. They are going to have to stop assuming that their patient isn't going to put in the work that they need to put in to correct their diet, to correct their environment, to correct their lifestyle choices. Same for their animals. And yeah, are there still going to be patients who are not going to be willing to do that work? Yes. But are they going to find that there are some patients who are willing to do that work? Also, yes. And so maybe if our doctors can put away that cynicism, if I can say that word, long enough to give people the opportunity to prove them wrong, then they will be more apt to give other people the opportunity to correct their diet and lifestyle choices. And we will all collectively learn that that is the real solution to a lot of what is ailing us. I guess I said everything I wanted to say. I don't know. Let me know. This is definitely different from any other episode I've really put out. So uh, I will like there is a part of me that wants to be able to interview people outside of our little circle and try to understand, but also to be able to push back. And that's not always the easiest thing to do, especially in the moment. Um, but that pushback is necessary. Uh, and I wish I had done a little bit more of it. I mean, obviously, like I said, he felt the pushback, but it wasn't as much as I had hoped I had done when I went to sleep that night. So, for that, I hope this extra little tidbit helps you understand a little bit better where at least my mind is at with the things he was talking about. So, please give your pets some extra love from me today, and I will talk to you again next week. Before you go, if today's episode got you thinking about what's really going on beneath the surface for your pet, don't forget to check out wildwellnesspet.com. You'll find the Wild Wellness Bioenergetic Test to help uncover hidden stressors, plus a curated apothecary of holistic remedies to support true root cause healing. Visit wildwellnesspet.com to start building a calmer, more vibrant pet from the inside out.